The information in this podcast is for entertainment purposes only. Consult your healthcare provider for proper care regarding your specific situation.
Welcome to Rattled Nurses, the podcast that's here to shake things up when it comes to pregnancy, breastfeeding, and postpartum care. Hosted by two experienced nurses, we're bringing you real talk, expert advice, and a whole lot of laughs as we navigate the wild world of newborn care.
Whether you're a first-time parent or adding another little one to the mix, we've got the tips, stories, and answers you need to make this journey a little easier and a lot more fun. So grab your coffee, even if it's cold, get comfy, and let's dive in. Hi, welcome to episode 4. We're so glad you're here. We've got some fun things to talk about today and some, I guess, surprise for each other from what it sounds like.
Yes. So how was your week? How was your St. Patrick's Day?
It was good. I worked the night before, so I spent most of my day sleeping away. Actually, no, that wasn't St. Patrick's Day. That was the day before. On St. Patrick's Day, I was actually taking my daughter back down to college after spring break.
I was going to say, what did y'all do for spring break?
We went to see a play. She is actually taking a appreciation of theater history class.
I can see that. That tracks.
So we actually went to see The Color Purple, an off-Broadway show.
How was it?
It was amazing, actually. It was really good. Highly recommend.
Very nice.
Yeah, it was fun.
Very nice. I didn't do anything exciting. I stained some of my fence and pruned my plants outside. So, yay spring.
In all the wind.
In all the wind. All right. I have my Sarah's stupid joke of the week. You ready?
Let's hear it.
Okay. So why do cows wear bells? Because their horns don't work.
Oh my gosh. That's funny. I'm always afraid when you tell me a joke that I'm not going to get it. And then do I pretend I get it? Do I go ha 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 ha?
Yeah.
That was.
Sometimes when I tell them to my husband, he'll do that pause and I'm like, laugh, dang it, it's funny. And he's like, I don't understand.
Or do it I know. I don't want everybody oh my gosh, she is really slow. I don't think we need to take advice from her.
I was trying to do the kid-friendly jokes, cause some that I've heard from my nephews and nieces, and then some that I just found online. But I'm like, because I'd be the same way. I'd be like, I don't.
I'm scared.
I need an adult. I don't get it.
Well, this one tracks with the one that you told last week.
Yes.
So what is the difference between a well-dressed man on a tricycle and a poorly dressed man on a bicycle?
I don't know.
Attire.
But
yeah, exactly.
That's pretty cute. That's pretty cute.
We are your commodians. Commodians.
Okay, guys, so I'm going to introduce a new mini segment, what I like to call names that would be kind of cool if they weren't actually things. So I've compiled a list of names. Again, some that I've thought of and some that I found off the internet. So if you have any suggestions or want to add to our list, please comment, subscribe, comment. So I made a list of them and I put them on flashcards. So this is a blind react. So I'm going to show them to Delana with the flashcards to see her reaction. Okay. I don't know. I don't even know what order they're going to be in.
Oh, my Lord. Here we go.
Read it out loud.
Salmonella. Nelly.
Salmonella. Come here, Salmonella.
Yes.
Okay. Oh gosh, this is my favorite. One of my favorites.
Anesthesia. Yes.
It just rolls off your tongue.
I can totally see that being name.
Anesthesia.
Annie.
It almost sounds regal. Annie would be good.
Annie.
Anesthesia. Nice to meet you.
Why do you always want to sleep, Annie?
She's just tired all the time.
Apparently.
I don't like this one, but I thought it was funny. Raby.
Raby. Like rabies?
Without the S.
Oh my.
Raby baby.
Raby. I can see that.
I wonder if that'll happen. We do see some wild names, but sometimes I wonder, I'm like,
But I've never seen that one.
I've never seen this one.
Never.
All right, we'll do one more. Yeah.
Vase.
It could be a male or female. Vase. Vase. It could be strong or it could be feminine.
It sounds more masculine, I think. Yeah.
Vase.
Vase.
All right, that's enough of that. Okay, that was my blind react. Stay tuned for more next time. Okay, so today we're planning on talking about basically postpartum and C-section recovery. What to expect, what's normal, what's not normal, the physical aspects, the emotional aspects, all that good stuff. Okay. So here we go. So you had a baby. A lot of the times I'll get this thing people will tell me and they'll be like, no one told me about this, or I forgot about this. Or
So many times.
So many times. Nobody told me about this. You had a baby, whether it's vaginally or by cesarean. Either way, you're going to go through some extended recovery, and it's not pretty. It's not a pretty process. Your first part, once you get to postpartum, you're recovering, you get to the floor, we're going to teach you how to take care of everything. It is normal to have what's almost like a menstrual period for the first few days after. That should lighten up, and that actually lasts for about 6 to 8 weeks. So it is normal to have that. We do want, we expect it to be pretty heavy the first day or two, and then it lightens up pretty significantly thereafter. So yes, it is normal to have that. It also will change consistency. It'll change color as you progress through your postpartum phase.
Particularly heavy, usually the first time or two that moms get up out of bed.
Yes.
I think that scares a lot of moms.
It does. You may have clots. Those do happen. I usually tell my patients grape and cherry size clots are pretty normal. But if they start getting bigger, or you start soaking a pad or feeling large gushes, please let us know. Or if you're soaking a pad in about 1 or 2 hours, or if you're at home, please call your doctor. Please call your nurse, whoever. Yep.
Yes. And another big one is cramping, pain associated with that. The cramping is very normal, and a lot of moms will say, especially after they've already had multiple babies, I don't remember it being like this last time. Well, that's because it probably wasn't. It gets worse, the cramping does, with each baby that you have, just because your uterus has become more stretched out with each pregnancy, and it has to work harder.
It does have to work harder.
To control your bleeding, and also to get your uterus back down to its normal size. That usually takes about 2 weeks. So there's a lot at the end of the tunnel.
Yes. It doesn't last forever, but
Yeah.
a lot of people do say it's
Intense.
It's intense. It's worse than the labor contractions, things like that. Partially probably because they don't always have the epidural,
Yes.
thereafter. But yes, this happens when you're breastfeeding. It happens when you've got to go to the restroom. It happens, even just looking at your baby or hearing your baby cry. If you feel it intermittently, it's not fun, but it's a normal pain, and it's a good pain. It's your uterus doing its job.
Yes.
We do have medicine for it, though, so ask your healthcare provider. Usually they'll prescribe some sort of medication while you're in the hospital to help with that.
Usually the NSAIDs work better for the cramping than narcotics will.
And most of the things we give, keep in mind, too, a lot of people do get concerned about taking the over-the-counter pain medications or other pain medications while they're breastfeeding. Just know that in our facility, we cross-check those. We do like to make sure most things that are offered are completely fine for baby while they're breastfeeding. However, we always have like a cross-check system to say, this may not be the best, but we can offer this instead.
Yes. Don't be afraid of those.
Yes. It's also normal to feel like you got hit by a bus, especially after you your back pain, your epidural, like where your epidural site was, if you had one. All the muscles that you had no idea that you were using, trying to push baby out. It's for vaginal and C-section especially. They go through multiple layers of tissue and fascia just to get to baby. So there's a lot of layers of recovery that are happening there.
I think the thing that shocks moms the most that I see is the pain that they have across their chest and their arms. Well, when you're pushing, you're using your whole body.
Yes.
And a lot of times they'll do what they call tug of war when you're pushing in labor and delivery. Or even if you're holding your side rails and pulling those to push against, you're using those muscles,
like the chest muscles
up in
and
your
everything.
chest and arms. So
I tell a lot of people, I do get a lot of that in question. They'll be like, why is my body hurting? I'm like, well, what were you doing like 12 hours ago? They're grabbing your rails, pushing down everything. That's why. Oh, yes. And that epidural pain, I feel so bad for these mamas sometimes. I mean, yes, we put a needle in your back. So I'm sorry.
And it's not small.
It's not small. And then the cramping. That's why we say bring a heating pad if you want to.
Yes, and I remember my epidural. I didn't have one with my first baby, but with my second one I did. And I remember feeling that soreness right there in that lower back for about 2 weeks.
Yeah.
So don't be alarmed by that either. And the NSAIDs are really good for that.
The hospital beds don't always help it either, but
I don't think
that's a different story.
Help anything, really.
No, they don't. That's a different story. So that is normal to feel that in your back, in your body, all the aches and pains related to that. If you did have an epidural, another thing that could be abnormal is if you're having severe headaches, especially while standing. Sometimes when the anesthesiologists are giving an epidural, they can have a little bit of the spinal fluid leakage. And that will sometimes, when that leaks out, that can cause a severe headache. So if that begins to happen, and we call it a post-dural headache. So if that begins to happen, talk to your healthcare provider. They may need to do something. You don't want to go home and just try to cope through that. That's horrible.
And the medications usually don't make a big difference. Yeah. And the one way that we kind of test to see if we think that's what it is before we call anesthesia is we'll usually lay you down flat. And when we say flat, we mean no pillow, no nothing. Like bed is completely flat and you lay down. And a lot of times you'll feel immediate relief if that's what it is that's actually causing the headache. And so if you experience that and then when you incline a little bit and it immediately comes back, then that's kind of a telltale sign.
Yeah.
And we'll give anesthesia a call and they'll come down and talk to you about options. You know, and some moms don't want to have what's actually called a blood patch to fix the issue. And so sometimes they'll just order some, drink caffeine, lots of caffeine. You can have coffee or sodas, that kind of thing.
Some of our patients do fear it a little bit. They think something else is going to happen, which I get. But most of the moms that I've done or assisted with a blood patch on, it's pretty much instantaneous relief. So keep that in mind. If that's something that's happening, again, it can be fixed. Just let your healthcare provider know. C-section specific, any more on vaginal recovery, essentially?
I don't
Those are the basics.
So.
Yeah, usually, your healthcare provider, whoever you have your baby with, is going to try to help you get up and show you how to take care of things, put in your pad, what to change, what to look for.
Using ice packs for swelling. Swelling is very, very common.
Tux
so we usually use those for the first 24 hours. Yes, the witch hazel or Tux pads. Some Dermaplast spray is typically ordered, and we can give that. And that's even available over the counter. So a lot of moms will, have some on hand that you can just pick up at any over-the-counter pharmacy and have that available, because you can go through that pretty quick.
Yeah. I think that's in like the first aid section. I'll tell my moms that if they need to get some more, it's generally in like the first aid section. And then the witch hazel pad's also over the counter as well. So you can get those for any day-to-day things going on. But yeah, we'll show you what to use, how to do all that. Okay, C-section specific. Yes, we did just cut a hole in you. We are going to try to get you out of bed as quickly as possible. I'm sorry, but it's going to happen. We're going to help give you medication if you need it, but we want you to start walking pretty much as soon as you are able to. We want you to be ambulating, walking.
For your own benefit.
For your own benefit. We want you independent. We want you being able to take care of your baby. We want you to be able to get up and hold your baby whenever you want to. Also, early ambulation, which is walking, will prevent blood clots, things like that.
And we don't see those often, but we did see one not too long ago.
Yes, it's true. Yeah, we try not to let that happen. Also, the more you walk, the more you get up and move around, the more your body is able to cope with it, and the faster your recovery will be. It seems a little silly when we say that, and like, okay, keep getting up, keep moving, it's going to help. They don't believe us, but it's true.
Well, you're expanding those lungs, helping prevent pneumonia. And, you just don't get as stiff and sore as you would.
Yes.
Even though it doesn't feel good when you're doing it, that first time or two, it just gets easier after that.
The first time or two, it feels like your whole insides are going to fall out, but I promise you it's not going to happen.
It's not. And a lot of moms worry about even coughing.
Yes.
If you have to cough or sneeze, it feels like you are ripping everything up. But I've honestly never seen that happen.
Yeah. We usually try to get you an abdominal binder, put that onto you. That really helps with the counter pressure. So you are not feeling, so you have some support there, and not only for walking, but coughing, breathing, living, doing anything should help that as well. Another C-section specific thing, the incisions. Your incision pain, it's not going to be fun. Yes, you're going to have soreness, but also with the incision pain, it essentially is we cut your nerves in half. The nerves get cut in half, and then when they start waking up and rerouting, they forget where they were and they start burning. So a lot of that will be nerve pain. It goes away. Again, it doesn't last forever, but when sometimes you have that significant pain and then it's not necessarily relieved by the medicine we give you, usually that's nerve pain. And yes, it is also normal.
And sometimes we do use ice packs for that.
Yeah, I use that too. Yeah.
I feel like that helps a lot of those mamas.
A lot of our providers have started prescribing like Neurontin, gabapentin. Sometimes it helps, and sometimes my families are like, yeah, that's really not doing much for me. So
Right. Yeah. But that's fairly new. I've started seeing in the last maybe 6 months or so.
Yeah, I think
it seems like
physician specific.
Yes. So. But more and more I feel like are using it now, in addition to the narcotics and the NSAIDs, because you can take them all.
It's also normal to feel like one side, if you have an incision, it's normal to feel one side more prominently than the other side. One side usually feels worse, just depending on how they were holding you open, how they were stitching, how they were pulling. So again, that's also a normal thing as well.
And also if you have a tubal ligation with your C-section, that can also cause quite a bit of increased pain, I feel like.
Having your tubes tied.
Yes. So there's lots of tugging and pulling and cauterizing and all that going on, in addition to having a baby taken out.
Yes. Another thing is gas pain.
Oh,
we get a lot of these poor mamas. That's why we ambulate you. We want you to get up. We want you to move around. We want your body.
It makes a huge difference.
It does. We want your body moving so your bowels can move, so you can pass the trapped air that's stuck inside you. Because if you're not able to do so, it just goes in your chest and your back and your arms, and it feels like you're being stabbed from all sides of you. So that's another reason. And if you start feeling that, It's a normal pain. It's not fun, but also something that is normal and can be fixed with a little bit of walking around.
Yes. And in addition to the walking, the heat packs help a lot with that as well. The heat can make a difference.
We try to find little extra things to help you out until your medications or your walking around can kick in. We try.
Mm-hmm. So. Absolutely. And we always encourage mamas who've had any kind of abdominal surgery not to drink through a straw, because you're just taking in so much more air, and that just makes things even.
Especially those giant straws that come with the hospital mugs that have all the ridges.
Yes.
For lack of better term,
collect so much.
They create so much air, and then they're like, oh. Sodas too. Careful of your sodas. Yeah, a little bit of ginger ale may help you if you're nauseated after surgery, but not too much. If you bring it in bubbles, you gotta somehow get out those bubbles. So just keep that in mind.
And then there's also different kinds of anesthesia that the doctors can use. If you have an emergency C-section, oftentimes they have to completely put you to sleep under a general anesthesia. In that case, typically moms will come out and they'll have what's called a PCA, where you have a little button that you push when you feel like you need some pain medicine, and it'll be all connected on your IV pole, and you'll get a dose as you need it. And we'll usually keep that connected for 12 hours or
a little while, yeah.
But that'll help with the pain. However, nowadays, I feel like most hospitals, maybe not all, but anesthesia-wise, they can give what's called Duramorph, which is morphine into your spinal when they're doing your surgery. And that really helps to control your pain for up to 24 hours. So a lot of mamas completely get fooled because they're feeling great after their C-section. They're like, oh, this is easy. This isn't bad at all. And then they start getting close to that 24-hour mark, and they feel like it just hit them.
It's coming back. It's all coming back.
Like a ton of bricks, and they don't know what happens. And sometimes they get scared because they're thinking something's
wrong.
Not right. Because I feel so much worse than I did yesterday, and what happened. And it's sometimes hard to explain and we even try to prepare those mamas when they come out that, tomorrow you're going to be feeling more pain. I know you feel like you don't need additional pain medication right now, but let me know as soon as you start to feel that, because if you let that pain get out of control, sometimes it's really hard to get it back to a controllable level where you're okay with it. You're not going to have no pain. Don't expect that. After that anesthesia wears off, especially. But to take it back down to controllable levels, sometimes I have to give my moms 2 or 3 doses, which sometimes may be over an 8 to 12 hour period before they finally feel like they can handle it again.
Tolerable.
So yeah, when you start to feel, uncomfortable, ask for something.
Yes, please don't ride. I call it the pain roller coaster, and I do something similar. I'll try to preamble and tell them in advance, hey, tomorrow is going to suck. It is not going to be fun at all, but just so you know, do not ride the pain roller coaster. If you start creeping up that roller coaster, let us know so we can bring it back down a little bit. Otherwise, just like Delana said, if you're trying to carry that pain all the way up, it's going to be more difficult to bring the pain back down. So don't ride the roller coaster. You don't get an award for not having pain medicine. I'm sorry.
Absolutely.
I'm sorry that sounds mean. It probably does. You don't get an award. You don't get a discount. Just take the pain medicine. Make yourself feel better so you can take care of your baby instead of being miserable.
Yes,
so
100%. I mean, we've seen moms in so much pain before that they didn't want to breastfeed the baby because it hurt too much to hold them.
Yes. They don't want to hold them. They don't want to do anything. So here's in your hospital too, our specific entity has a booklet that we give out. We're not expecting you to read the entire booklet while you're here. We know you're tired. They really should offer these at your physician's office, but I just work there. So this is something that we have and we give, and I've deliberately blocked out our entity logo, but it's basically just after delivery, taking care of yourself. It's got some fancy little QR codes in it so you can scan, but it basically is talking about yourself, your recovery, things that are normal, things that are not, your vital signs, lots of good stuff. There is also a lot of support recommendations on the back should you need them. If you need help with breastfeeding, if you need help with other resources, postpartum depression, suicide hotlines, behavioral health resources, a lot of those. Our milk bank that's in our area, that's even on there in case people want to go purchase their own donor milk. So if your hospital doesn't give you one, or wherever you deliver, maybe ask about one. It is a good resource to take home with you. That way you can do a quick flip back and look.
Okay. So, speaking of, you mentioned the postpartum depression resources there.
Yes.
We do ask all of our patients, whether you've just delivered with us or even if you happen to be readmitted for complications such as blood pressure or infection or anything really, that we have you fill out a what's called an Edinburgh postnatal depression scale. And that is just for your own benefit. There's never any judgment attached to that at all. We know that when you have a baby, that hormones do fluctuate. Everything feels wonky. And so we're just checking on you and seeing if you might be a candidate for additional resources or help. If we see that you do, we reach out to your physician. Some doctors will go ahead and start medications if that's something that you would like, just to help you feel better. And it's not anything that anybody has to stay on long term typically. But sometimes moms just need a little extra help to feel like themselves and like you can take care of yourself and your baby.
Yeah, listen, fam, it is not just physical. It is definitely emotional too. Like there's so many hormonal changes. Just like Delana was saying about the depression score, please answer it.
Yes.
Truthfully, we want to help you. We're not trying to trap you there. We want to get you resources. We want to help you through with whatever you need. We want you to be successful and we want you to thrive essentially. So keep that into account as well. There's going to be your physical changes, just like we talked about, and then your emotional changes as well. What is it? Several months of emotional healing for sure until your hormones kind of level back
your
out.
Your hormones and your sleep.
Yes.
It's all got to regulate again.
Yes.
That takes a long time. And I can tell you that from personal experience, when I had my first baby, I didn't quite feel right. I wouldn't say I was depressed by any means, but I didn't feel like myself. I felt like I just wasn't quite right, and I really couldn't put my finger on it. But I was not comfortable even saying anything to anybody because I honestly thought there would be judgment. Looking back now, I know that was a crazy thing for me to even think because I have a very supportive husband.
Well, that's why we talk about this because most people, I mean, even to this day, there are a lot of people discuss mental health, but again, people still feel like it's a stigma to be sad or something, have the baby blues after the baby, and they should be happy because you just had a baby.
Yeah, don't listen to people that say too blessed to be depressed and all that.
Yeah, that's not what we're trying to do.
That's not a thing.
We want to set you up for success, and it is normal to have these. It's normal to talk about it. It's normal to talk about with your nurse. I mean, you could be sitting there holding your baby, having a good time, and then cry for no reason, and that's fine. It's okay.
Yes.
So,
and then looking back, after I had 5 years between my two babies. And then when I made it to that second pregnancy, I thought, well, that was the craziest thing ever because Ed and I, my husband, we tell each other everything. And I never told him how I was feeling at the time. And then when I was pregnant with my second baby, I did tell him, you know, I just need to, we sat down and had a talk. I said, I need to tell you, this is how I was feeling with the first pregnancy. And we had this discussion as soon as I found out I was pregnant. And I told him, I said, I need you to just check on me every now and then, because I don't know what my mental state will be like, but I just need you every now and then to just say, hey, how are you doing? How are you feeling?
You want to talk about something, anything.
Yes. Because if you ask me, I'll be honest, but I don't know if I start feeling that, if I will.
Are you going to bring it up? Yeah.
Right. Because it's a hard thing to bring up. It's a hard thing to talk about. It's emotional to talk about it, or to think that you could not feel great when you have this new baby.
Yes.
So anyway, it's nothing to be ashamed about, and there's a lot of women who do go through it, and we want you to be open about it with us so that we can support you.
Yes, that's what we want. There is a significant question on this particular scale that
I do have a copy of it with me.
I was going to say, let me read it. But yes, this is a kicker. So, and it is in fact, if you do answer a certain way on this one, we do sort of have to intervene a little bit more strongly. But again, that's not saying we're trying to hold you there. We want to make sure you are safe to go home, and you are safe to go home with your baby. Again, we're not trying to take your baby away. We want everybody to be okay, but it talks about the thought of harming yourself has occurred to you, if that's ever happened. So that's a pretty significant one too. But again, I tell people, if this is your answer, I'll accept it. You know, I'll put it in. We'll go through we'll go through the motions, but just so you know, this is what it entails.
And when we give you this in the hospital, this is asking you how you felt over the last 7 days. It's not in that moment, like if you had a traumatic delivery and it was the worst and you're just feeling really terrible about that. It's the past 7 days, how you've been feeling.
Basically what I tell people, like leading up to prior to baby.
Yes.
So again, answer that honestly. Don't have your family member fill it out for you. I don't mind if they read it to you, if they put the right answers that you're telling them, but please fill it out for yourself.
And if it's somebody that you feel like you can be honest in front of them. If not, heck, I don't even care if I go in a room to collect it and you say, hey, so can I have another one of these, because I think I need to fill it out without, you know, my
significant other person
there to see all of my answers.
Yes, that's okay too. Yes.
Absolutely.
We will not judge you on that. Yes, we'll bring you another one. Oh, sure.
Yes. So, just be honest with us on that, and we'll help you out as much as we can.
Something we also do, we get social work sometimes involved too, and that's not, it's just so we can provide you with the resources that are available. Sometimes if your mentation, if your mental health is related to resources that you may or may not have, we can get you resources. We'll generally try to find some resources for you. We have a lot of hospital, not necessarily affiliates, what you call them. There's entities,
just kind of partners that
there's entities around our area that will specifically help moms in need, or families in need, or families in need of assistance with like domestic violence or trafficking. There's a lot of things that we can do. So sometimes we'll get
even if you can't pay for you know, diapers or formula, those people can help you, you know, or even offer classes to support if you feel like you just don't have the knowledge base that you need to take care of a baby. That they offer classes that can help you with that as well. I can't talk. They can help you with that as well. That's not important. It's just a podcast, right?
If we don't even bring it up, you can ask about it. When my mother was in the hospital, I had to ask. I'm like, this is going to be significantly expensive. What resources do we have? Like, I had to reach out for them so that we could get some of those resources taken care of. But anyway, just so you know, none of this is necessarily it's not a bad thing. We just want to check and make sure you are doing okay, and that you feel like talking to your healthcare provider is a safe place for you.
Yes, 100%. And, if you have any questions about any of it, be sure and go onto our social media sites and submit those questions, and we'll be happy to answer for you.
Yes. I had a mama one time who she was so stressed out and so upset. She didn't know what to do. And I don't think she necessarily, maybe her significant other, her support person was at work and she didn't know what to do. And this was on a night shift. I don't know if you were in charge or not, but she came in, she just brought her baby to we have an OB emergency room that we can always help you. But she brought her baby through the OB emergency room, and she was like, I just haven't had any sleep. So because it was,
I don't remember that.
Yes. And I was going to say, because it was a night shift, we just kind of brought her back in, gave her a bed, watched her baby in the nursery, and then she felt so much better, but she was at her wits. And so we were able to do something for her about that, even though it wasn't like she was not admitted as a patient. She was just, we wanted to help her. She didn't have the resources, and we didn't want to leave her high and dry outside. So
yeah, we always do what we can.
Yes.
We're all in this together.
I had one do that not that long ago during the day. Like, she just needed help breastfeeding, and she was also at her wit's end. And I said, come on in, Mama, let's sit down in this room. So I picked an empty room, and we did get lactation in there, to help her as well. Just a little extra, but
yeah, it's hard.
Yeah.
It's hard sometimes. We understand.
Okay. Well, I'm thinking that's it for this one.
So I think we've covered all the grounds there.
Yes. Please feel free to reach out to us as well if you feel like if you need a number for something or a way to access emotional support helplines. Like, there are a ton of postpartum depression, like postpartum support. Like, I think one of them for sure is postpartum. It's PSI. It's Postpartum Support International. They have lots of resources. There is a helpline that is in our description. If you need that, an emergency helpline, as well as there's lots of groups and everything likely in your area. There's Facebook groups. I had a friend recommend one that's called Wings for Wellness or Wings of Wellness. And that was a Facebook group. And she said just getting on there and reading other people's stories and experiences, significantly helped her. 'Cause she was like, okay, I'm not alone.
Yeah.
This is okay. I don't feel as bad. I'm not alone. So.
And maybe we can post some of these on our social media site
absolutely.
as well, like the international numbers, or not international. You know what I'm saying? All the ones that aren't just local.
Yes.
So we can put those on there for you. So.
Okay. Well,
all right.
That's all we have for today. Like, comment. If you got any questions, please leave us a comment. Like, subscribe, share.
Please.
It's good talking to you.
Good night.
Good night.
Thank you for listening today. The Rattled Nurses podcast is not intended to provide medical advice. It is not endorsed by our employer, and we are not speaking on behalf of our employer. Our commentary and stories are our own.
Also, on a serious note, we want you to know that if you are feeling blue or depressed, it is okay. You're not alone, and there is always someone to reach out to. You can call the National Maternal Mental Health Hotline at 1-833-TLC-MAMA, or text the crisis line. Text HOME, HOME, to 741-741. Remember, you're doing a great job. Now go warm up your coffee.